Today, we'll be talking with neurosurgeon Dr. Michael Meriwether, and we thank you for joining us today.
My pleasure, Myron.
Today we're going to do something a little different than we usually do. We're going to talk about a procedure, but we're also going to join you in surgery to show an actual surgical procedure. Today, one that's going to be dealing with the neck. Dr. Meriwether, perhaps you could give us just a brief outline of what it is we're going to do and why you would do this.
Certainly. We're going to be looking at a patient that has a problem with a herniated cervical disc and needs that cervical disc removed and or may need some further surgery in terms of putting a bone substitute or a bone graft and a plate to fixate that area or fuse that area. This is a very common problem, and it's a common situation that we see, that patients have had a neck injury, have developed a problem, have not responded well to the usual methods of physical therapy, anti-inflammatory medication, the sorts of pain medication that may be needed if it's a severe problem, and come to us with an MRI scan and a physical exam showing that they have a herniated disc problem in their neck.
One thing that I think viewers will find, Dr. Meriwether, is the lack of blood. Now, I would think when you open up someone's neck, you would see blood just gushing out, but I was very surprised to see how little blood there actually is.
Well, occasionally we've seen that, Myron, and we haven't been happy to see that. But frankly, all kidding aside, it probably takes more blood for the patient to go through preoperative testing that the laboratory technician draws from their arm than we lose at this sort of surgery, because we are in an area, though there are some important vascular structures nearby, there's a natural plane in the body or a natural space that we get into, and it's basically bloodless. The disc does not have a good blood supply, as you may or may not know, and so the actual surgery of working on the disc itself and doing the disc surgery is not a bloody procedure at all. So often the amount of blood that's lost in this is certainly a lot less than they draw out of your arm for the preoperative blood testing, and we're not unhappy about that at all.